is liposuction?
Liposuction is the shaping of the body by removing excessive fat from selective areas of the body with the use of a suction cannula.
Who is a good candidate for liposuction?
A good candidate for liposuction is an individual who is in normal or slightly above normal body weight, who does not have generalized obesity, who has got good skin tone, and who's got localized areas of fat that they cannot get rid of by dieting and exercising.
Specifically, how is liposuction done?
Liposuction is done through a variety of different techniques, but for the most part, the idea is the removal of the fat with fine gauge cannulas, which are essentially small metallic rods that are inserted through very small incisions into the skin, and they extract the fat either by removing it with mechanical force, meaning by a suction device, or by first dissolving the fat with ultrasound and then taking it out with this mechanical device.
And how long is the recovery for liposuction?
Generally speaking, if you do not do excessive liposuction, and most of us don't do excessive liposuction, the recovery for this operation is about 1 week.
And what should an individual who is undergoing liposuction look out for?
The most important thing to look out for is not to overdo liposuction, because that's when you can get into trouble. Most of the bad things that people hear either on radio or television or they read about in newspapers about liposuction is when somebody has tried to do too much liposuctioning in one day.
After having done liposuction, how long does it take before an individual can get back to their normal routine?
Usually the recovery for this operation is about 1 week.
1 week. And if an individual really wants liposuction, what's the first step that they should take?
The most important thing that they should do is to talk to a well-qualified plastic surgeon. The plastic surgeon can tell them, first of all, whether they're a good candidate or not. If they do not have any medical issues, or if they are in good health, and their body is got only localized areas of fat, they would be a good candidate for surgery. The plastic surgeon can also tell them how much liposuctioning would be necessary to get them to the point that they want to get, and whether or not the liposuctioning should be done in the office or in an outpatient setting or in the hospital. So the most important thing that they should do is to talk to a plastic surgeon.